So did you know way back when surgeons were also barbers too? So I'm going to teach you a life-saving skill here in this COVID-19 time. So what I clearly need to do here is a reduction of the excess hair circumferentially from one ear across the top to the other ear. So this is what we need to reduce here today because there's just frankly too much excess hair. So the procedure that we're going to be doing here today is called a 360 circumferential hair reduction. And what I'm going to do here is I'm going to cut every single individual hair from the top of the ear, across the hair, across the top of the head, out to the other ear. So this is the anterior shot. And you can see from the side shot, this is what we need to remove. All this excess hair from the sides, this transition zone, as well as the top. So this needs to be significantly reduced in terms of height and volume. So my favorite surgical instrument to use here is this Wahl. It's nice handheld, it's good ergonomics, and it's really good. It doesn't have to be sterile for this procedure we're going to be doing today, but I like to use this 3-guard or this 10 millimeter or 3/8 of an inch for the sides. So we're going to do the sides first. So what you want to do is you want to turn it on, you want to have that bracket up, and then what you want to do is you want to go up with it, up with it, up with it, up with it like that. So you want to go all the way around. And you want to go in here, but you just want to keep on working its way up. I'm going to do the sides first. You go all the way around to the other side, and you can see we're getting a nice clean cut. I'm going to take my time on the back side here. Now I'm going to go to the other side. Here we go. So I could leave it like that, nice and short on the side with much longer on the top, but not really my style. So now I'm going to switch over to a number 6 or a 3/4 inch or metrically inclined 19 millimeter. And I'm going to do the top. So with the top, I go from the front backwards, and then I'll go from the backwards forward to make sure we get everything and blend in the sides. So here we go from the front. What I like to do is go from the front, back, front, back, front, back, front, back, front, back. You get the idea? All the way back. And then I'm going to take them back and go forward. That really gets it. Back, forward, back, forward. You get the idea. Back, forward. Make sure you don't get your eyebrows. All right. Working on it. So here's our final result, and you can see a significant improvement in the height and the volume of the sides, the top and the other side. And you can see how happy this patient is with his results. He's very happy immediately. Procedure doesn't take that long. It takes me about maybe 30 minutes to perform, and no anesthesia is required. And so there's no after effects of the anesthesia, no pain medications required, just a little cleanup. This is the anterior shot. And from the profile shot, you can see that significant reduction in terms of height and volume, all the way from the front of the hairline, across the top or dome of the head, back of the head, into the neck region, and a significant reduction above the ear. So you can see this patient's very happy with his results.